Alrighty. Once the baby is again implanted in the uterus, this muscle, boy, does it stretch. Again, it's gonna stretch to be the size of the full-grown baby that's coming out of the uterus. So it's going to stretch. Baby's going to live in there for 9 months. It has this amniotic fluid that it lives in. Again, you don't get your period or anything. You usually have no bleeding, so all that's going to build up too. When baby is ready to come out, the exit to the uterus is called your cervix. And basically, this little area has to stretch quite far. And how they check is, well, they'll say that if you've ever, your parents or anyone you've ever heard on shows, they're going to check how dilated you are. And basically that means how many centimeters your cervix has opened up to. So you start at 0, right before baby's ready to come out. You might be 1 or 2 centimeters dilated, which is normal. If you still have like maybe a couple weeks left of pregnancy, your body's basically getting ready for the baby to come out, and it could take a while. It's different with everyone and everyone's body, but the cervix is eventually going to expand to 10 centimeters, and how they decide how dilated you are is the doctor sticks their hand up into the vagina, and it's how many fingers you can fit into the cervix. So if they fit 2 fingers into the cervix, then you're usually dilated to a 2, 3, 4, 5. Eventually, when the baby comes out, 10 centimeters is about like putting 2 of your fists together. It's pretty big. I mean, the head is probably the biggest thing that has to come out. And when we're talking about a baby's head, they have more bones in the head because, this isn't a huge hole to come out of. So the bones have to kind of overlap so that baby can kind of squish out, and then the baby has those soft spots on the skull because they have to develop and fuse together over time, which is why it's really important to be careful when you're holding babies and not to drop them, because the brain trauma could be substantial because their skulls are not developed. But if the baby had a full enclosed skull, there would be no getting out of the cervix. It's a very small hole to push a baby out of. Once it gets past the cervix, it's going to go through the vagina. This is the birth canal. So this is where baby goes to get outside of the body. The vagina is also where the sperm enters the female, and then where the baby exits during birth. After the woman gives birth, everything will usually go back to normal. It'll take some time, so your cervix will go back down. Your uterus, usually when you're done giving birth, they come and kind of palpate or push on the uterus to make sure that it's going back down to its normal size. The uterus is a muscle, so if you stretch and use this uterus too much or too soon after giving birth, it'll not go back to its normal size. So then you get people that may look just pregnant all the time, but maybe it's just something happened with their uterus and it didn't go back down, or they had 2 babies really close to each other, or too many. There's, it's a muscle and it needs a break, which is why they don't, recommend having babies close together. And I'm guessing close would be like, under a year. They recommend at least giving your body a year to kind of recharge and rest from giving birth, because like I said, it is quite the process. So after baby comes out, there's still this placenta in there, and it's attached to the umbilical cord, Everything comes out after, and then you didn't get your period for 9 months, so that comes out after as well. So after you give birth, you typically bleed for about 4 to 6 weeks. And it's not like a light bleed, it's a lot of bleeding and blood clots, and it's not cute. But everything's got to clean out and, reset so that you could have another baby if you wanted to. But everything comes out with baby, and then everything should go back to pretty much almost normal. There probably is normal to have a little bit of a stretch on the uterus because it's been used before, but I mean, that's just to be expected. This is the menstrual cycle. So this will show us at what point does our body release the mature egg, and at what point, are we most fertile, and when is our body reset if we don't have a baby. They consider the start of your menstruation cycle when your uterine lining breaks down and menstruation occurs. So all the lining in the uterus, it didn't get used. There was no implantation of an egg. So everything is going to strip down and come out the vagina, and it's going to reset for next month. Again, you release one egg every month, usually. That's how you get like twins and stuff, or triplets even, if by, accident more than one egg is released, or you have identical twins where the egg basically splits into two after it's been fertilized. But anyway, so usually the first 5 days, give or take, is when you're actively menstruating and bleeding out of your vagina. Then the next 5-6 days, your uterine lining starts to thicken again, and it's preparing itself to implant the baby. Ovulation usually occurs on day 14, but we have this large window where ovulation can occur, and it's different for everyone. Some people use a calendar to track their ovulation so that they can get pregnant easier, or vice versa, and they can avoid pregnancy by not having sex when they're ovulating. But again, everyone's body's different, so there's no exact way to say when you're ovulating. They do have tests that can tell and predict when you're going to be most fertile, if pregnancy is what you're trying to do. But again, the egg gets released, and it's basically going to hang out until it meets up with a sperm, and it's hoping to be fertilized. That is the whole point of the cycle, is to get pregnant. And if you don't, it's going to try again next month. The uterine lining continues to thicken. It's important to note also that during this day of ovulation, sperm can survive in the female body for up to 3 days. So if you had sex and the man ejaculated inside of you and you weren't ovulating, but 2 days later you ovulated and there were still sperm stuck in like a fallopian tube or something, you could still get pregnant. You don't have to ovulate first. It could happen after. The chances are slimmer, but again, it only takes one sperm to meet up with the egg. So that's why using the ovulation calendar isn't the most effective birth control method, but it could be effective for knowing your chances of getting pregnant if that's what you're trying to do. If the egg has not been fertilized, the uterine lining is shed again, and a new cycle occurs. Again, this happens about once every month. It lasts about 28 days on average. Basically, every month your body is setting up to house a baby. And have a nice, cozy place for it to grow. So that's why, we're looking at how we can prevent it. But again, the only 100% way to avoid unintended pregnancies is abstinence, because there's just so many things that can go wrong. We're going to talk about why birth control isn't 100% effective either. But your body's goal is to have that baby implanted that month. A lady will go through something called menopause, and that's when you no longer get your menstruation cycle. The age that people go through menopause is usually different, but it's normally happening in your 50s, late 50s. After you go through menopause, you no longer produce all of the hormones involved with the menstruation cycle. So that's where people, associate menopause with crabbiness or what have you. But basically after menopause, you are way less likely. Stupid bell. You're way less likely, if not at all likely, to get pregnant. It has happened before. Your body could still technically ovulate, but you're not getting that period. It's any more monthly, so it's less likely to happen, but it could still happen. So it's about a 28-day cycle, and, only about a week, 5-7 days out of it is when you're actively menstruating. Just because you had sex over here doesn't mean you still can't get pregnant during ovulation. Again, it's usually on day 14 in your cycle. So you could try to track it on a calendar, but most people do that when they're trying to get pregnant. Keeping your reproductive system healthy. We're going to talk about, obviously, cleanliness. Like the boys, you're more likely to have bacteria and fungus grow in a area where it's, technically it's warmer. It's always covered by like clothing. It doesn't air out a lot. It's more moistened. We have tampons going in, toilet paper, things that can cause infection if we're not, wiping correctly or washing appropriately, things like that. Obviously sexual abstinence, just like the boys, avoiding STDs and STIs. Especially for moms giving birth. If you have an STD or STI, it could, like gonorrhea, for instance, can cause blindness in babies if they're being born to you. If you have HIV or AIDS, your baby's more likely to contract it from you. Just things like that. Prompt treatment for infections such as UTIs, like bacterial vaginosis and like yeast infections. Women have shorter urethras than men. And basically, the vagina is a separate hole from your urethra. So you have your vagina and your urethra would be above it. So the women have 3 separate holes for 3 separate purposes. Unlike the boys, only had 2. The boys had their rectum, where you discard fecal matter. And then their urethra actually doubled, and they also ejaculated semen through the same tube. But with women, the urethra is above the entrance to the vagina. The vagina is a separate sex organ, where we obviously shed our uterine lining from, and then we also have the rectum for the fecal matter. So there are 2 different ones, but the UTIs and things like that are definitely caused in the urethra. Women are more likely to get them than males because our urethra is shorter, so we're more likely to get infections. They can appear to have side effects similar to STDs, but it's always a good thing to get anything checked out, any sort of stinging and irritation around the reproductive system, especially if it stings when like you're urinating or there's a foul smell or a weird discharge. You would want to go to the doctor and get that checked out right away.